Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with laboratory aspect of convulsion. Convulsion, what do you really do? What do you do when you are faced with a child that is convulsing and in a gathering and you have a medical experience and yet you are looking? At least something must be done to save the situation before the other aspect comes in. So it is therefore necessary for me to expose a kind of intro knowledge into convulsion itself. The condition underlying what is making people convulse. Convulsion is more of a symptom. You see the symptom, but what is the underlying cause? That is where the involvement of the lab becomes imperative, and that is what I shall do as we move on into the slide session. And as usual, I urge you to subscribe, press the like button, and more quality production will come your way. Let's move on into the slide section. The outline. Objective, introduction, type of convulsion causes, laboratory diagnosis, and the conclusion. The objective, to create more awareness of the conditions associated with convulsion and the first aid necessary to prevent complications and also save lives. The introduction. A convulsion is an episode in which you experience rigidity and uncontrolled muscle spasm, along with altered consciousness. The spasm causes jerky motions that generally last a minute or two, or it could extend to 5 minutes if it's epileptic, or minutes based on the underlying conditions. Convulsion can occur during certain kind of epileptic seizure. It can be a symptom of a number of conditions, including a sudden fever spike, tetanus, or very low blood sugar, which would necessitate laboratory diagnosis. Types of convulsion. The National Institute of Neurological Disorder and Stroke defined some causes and label some more on the seizure, that is epileptic seizures. It is less of the convulsion. So we are starting with the more serious epileptic 1, seizure, 2, febrile seizure, 3, non-epileptic seizure, 4, PKD, and 5, medication reactions. The other causes and which we could so label as type is acute hypoxia, vitamin B6 deficiency, heat stroke, and hypoglycemia. Let's go into the causes, but let's first of all understand that convulsions is quite different from epilepsy. The epilepsy is so common that people, once you convulse, they at times describe it as the person is epileptic, but that is not true. Convulsions are rapid involuntary muscle contractions and are different from seizures of epilepsy that I shall treat the cause last. So what could make a person convulse could be heat stroke, hypoglycemic, hypoxia, vitamin B6 deficiency. Then you could also graduate for conversion to epilepsy, serious seizure, and that's where the epileptic problem is that affects the brain. It could even be outside the brain. So expansion, I will expatiate more as we go along. Yeah, the number one we'll be treating in conversion is heat stroke. This was a personal experience of recent even, where a little girl in the gathering in the church congregation steadily was affected by heat stroke, and she started jerky movements, strength, and what have you. But people would not even allow much hair to even blow her, and so I had to come in, took the child, placed her on the, but there was no fan, so she was eventually taken outside. And after a little while, not up to 2 minutes, she became normal again. And that is why one must look at the situation around, whether it is the too much heat, and so you try to make the person lie flat, and water compression, and even take some water. Yeah, another cause of convulsion is severe hypoglycemia. When you talk of severe hypoglycemia, you are talking of very low sugar level in the system, in the blood of a patient. The American Diabetic Association defines severe hypoglycemia as a blood glucose reading of 54 milligram per deciliter or below. This is very much not compatible with life. This extremely low level can cause severe cognitive impairment with possible loss of consciousness, seizure, convulsion, coma, or death. The third one is hypoxia, when there is a lack of oxygen. Acute hypoxia can lead to epileptic seizure, and its clinical manifestations are similar to those of idiopathic epilepsy. Chronic hypoxia increases the level of central oxidative stress and neuroinflammation. So all these were the works of Ong W. Tail. So many scientific research has been done on that, and it could be responsible for this serious jerking and muscle twitching and convulsion. Yeah, we could also talk about epileptic seizure. That is the one that has to do with the brain. There are electric disturbances in the brain. You see the person really coming out with foam in the mouth, and it could last for many minutes, and it's a chronic problem at times. But the child could outlive that and become normal. There is also febrile seizure. It's almost like the one we talk about is stroke, but this is from fever, or it can affect children between the ages of 6 months and 5 years who are experiencing a fever. They are generally harmless and do not require treatment. However, if seizure goes on for more than 5 minutes, or if the child does not recover quickly, it is essential to call an ambulance. It's very necessary that once something, the first aid is not effective, please move straight to see the doctor. The ambulance will be very useful in making it speedily to the hospital. Non-epileptic seizure has nothing to do with the brain as well. They are due to mental illness or stress. Yeah, number 7, we could talk of PKD. It's a genetic condition. Research has found that anticonvulsant drugs such as carbamazepine are an effective treatment for PKD. So that is also a very useful information. The 8th one is a medication reaction. Epileptic Foundation provides an extensive list of toxins and drugs that could trigger epileptic seizure. So we have also known of the B6, where there is B6 deficiency too, which could put us 9. And the lab could always be very useful in knowing the deficiency. So the B6 deficiency can also be corrected. The laboratory diagnosis. After a neurological examination has been done by a neurologist, the following tests could be done. That is to know the underlying condition that could be responsible for this convulsion or seizure, that is epilepsy. Blood and lab tests. To check for signs of infection, electrolyte imbalance, and generalized markers of inflammation. So these are done. Hormonal tests are also done. And if the CSF is involved, that is, if it's meningitis that is affecting the brain touches, then the CSF will be studied for infection. If epilepsy is suspected, the doctor will require the blood test that measures the amount of the hormone prolactin. So the blood test is also useful to confirm if it is epilepsy. EEG will also be able to confirm epilepsy, that is the electrical discharges that is causing that epilepsy. And imaging studies for evidence of brain lesions or tumor, as well as signs of bleeding, clot, or subdural effusion is also another diagnostic, very useful test. Finally, conclusion. It is necessary to always bear in mind the situation around the convulsing person. For example, where the place is very hot, where you experience it yourself, you are sweating, you could suspect that heat stroke could affect the children, and dehydration could be also a serious problem. So it is better to now treat that by taking the child out to where there is enough water, spread the child on the floor as exposed in the treatment of heat stroke. If it is seizure, the person or the child will also be jerky, but better to roll them on their side in the recovery position as shown in this picture during the seizure. If they have fluid or vomit in their mouth, put something soft under their head and shoulder. Remove any sharp or unstable object from the area so that they won't hurt themselves. And don't try to hold the person down or stop the jerking. Just try to stop them from injuring themselves as shown in this photo. Always remember that if the seizure lasts for more than 4 minutes, rush the patient to the emergency unit of the hospital. Let us also bear in mind that if it's hypoglycemic convulsion, there is a need to give glucose D. But when there is no glucose D available, all you just have to do is get a bottle of Coke, Pepsi, or whatever, sugar, this refined sugar, and let the convulsing person take it, even if it's a granulated sugar with water. This will revive the person, and but resting on the left side of where the heart is located is also a very useful way of first aid. If you like my videos, please, there are so many videos on this channel, and this is the 150th video. So there are so many interesting health topic information necessary for survival. Thank you for trying to subscribe and watch more videos.